Here comes the beauty queen. Here at the workplace. What do I have for you? I want to share with you some of our surgical processes since I'm in CSST. It's also part of surgery departments or surgical departments. I cannot be without letting you know how the building in me with the surgery. How this is what the beauty queen is bringing you. I'm here to bring you pre-operative care, intra-operative care, and post-operative care. When I talk of pre-operative care, I mean the processes that a patient will pass through to make a surgery successful. When I talk of intra, I mean during the surgery and after the patient is brought back to the ward is intra. Post-operative care. When the patient is inside the ward, what you do for the patient to survive within 12 to 24 hours are post-operative care. Let me start with pre-operative so that your anxiety of coming to the hospital if you have a surgical issue will be solved. Most at times, as I said already, hospital is the second heaven. Anytime there is something wrong with you and a doctor tells you to come in for a surgery, you have to know that we, the prognosis, together with both the medical and the paramedical staffs, are there to help you with the process become a successful one. That's why I'm here with you, representing the beauty queen. Now let's go and take what is in there with the pre-operative care. Remember, before you enter the ward, the surgery would have already been booked by the doctor. When you come to the ward, the necessary items needed for the surgery will be asked from you. If you've forgotten some, we alert you to know what you are supposed to add up. I will group the pre-operative care into spiritual, physical, socio-economic care. When I talk of spiritual, I mean early in the morning when you are preparing for the surgery, we will ask you to seek your faith of any aspects. If you are not ready and you want to ask of someone to come and represent in your sick faith, that person can come and do it for you. Then the physical aspects go with the top to down. Remember, personal hygiene need is important. We will tell you, or we will ask you to go and have your bath. Then the sites which you are going to be operated on will be examined. Before you go to the surgery room, the doctor will come and observe if you are the right patient or not. Then the nurse continue with the preparation. Your theater gown will be worn. Your private parts will be shaved if hair is there. The incisional parts will also be shaved if hair is there, depending on the type of surgery you are going to make. When you come to the hospital, we have various types of surgery depending on the site. Depending on the type of surgery too, we will ask you to either fast or don't. Then, if you have any jewelry, you will be asked to remove. Beads, you will ask to be removed. Then, if your hair is too much, we will ask you to modify it and put scarf on it to make it suitable for the surgery. Then, if your nails are colored, we will ask you to clean it with the indication of observing if you have the right toe color or nail color, signifying if you are not anemic or dehydrated. Then we will alert you that privacy is very confidential with we, the health professionals, so that you will not be scared of what or when we tell you to take off your panty, depending on the type of surgery. A correct bed, that operation bed, will be laid for you, ready for you to lie inside. Well tucked in, free from creases and cramps, making you comfortable. Remember, consent form is there for you to sign so that you will agree with us of the surgery. Patient right is very necessary. If you don't want us to do the surgery for you, by the time we dress you up and you are scared, that's the second explanation for you. Remember, the first one will be done at the consulting room. Then the second one will be done when you are dressed up. If you agree, consent form will be signed. That's the agreement we are having with you, so that you go in for the surgery. Without it, the surgery cannot be done for you. Socio-economically, we will tell you the cost of it right from the consulting room. When you come, we will ask of you if you are having health insurance to reduce some costs for you, or ask you if you know of the costs of the surgery. Then the intro takes place when we are taking you out of the ward to the theater. All the observations from you is during that period of time. We will continue to reassure you, so to boost your confidentiality. When you get to that stage, vital signs will be checking in between so that we know how stabilized you are to take you to that surgical room till we hand you over to the theater health professionals. They will start with your process, and after that, the nurse or the health professionals at the ward will be called to come for you. After you've recovered from the surgery they made you, those at the theater will make sure that you are fully recovered till they hand you over to the ward health professionals. Remember, in order to avoid or prevent anxiety from you, proper handing over will be done even if the person whom you came to meet or who brought you to the theater to hand to the theater health professionals is not around. The person will introduce him or herself to you well, so that you know that you are at the right personnel's hand. The post-operative care will begin immediately that person, that health professional comes for you. The person will let you know by mentioning your name and introducing him or herself to, observing the parts if that place is dry. If that place is dry, the person continue with the care. That's the post-operative care. It begins by checking vitals if you are stable there and asking of your baseline data from the recovery room, making sure that everything is okay with you. If that side is bleeding, reinforcement is done immediately. Remember, that side will not be taken off to avoid infection, but rather add up with the pressure so that the bleeding will stop. Proper observation will be made when carrying you to the ward. When you reach the ward, Vital signs will also be done and correct observation. Apart from vital signs will also be made. 15 minutes, 30 minutes, 45 minutes, and so on. We make sure that if hydration is needed, correct infusion is given based on prescribed one. We, the health professionals at the ward, will check or cross-check your post-operative documentations from the surgeon to be as a guide line for us to follow, and adding up our own ones at the ward to save you. Yeah, I want you to take away all anxiety when it comes to surgery at the hospital, because great and proud health professionals are there, and competent ones as well are there to help you through. The beauty queen, I will never lie with my reality when it comes to surgical terms. If you are supposed to go in for continuity of care, the health professionals will alert you to go in for continuity of care. The post-operative care will continue till the next day when everything is okay. Proper handing over will also be done for the night nurse to continue with your medications, pain management, dressing if so, and all kind of things. Remember, nothing will be left off for post-operative care based on the surgery. The beauty queen, Nana Afia Pokuaa, is bringing you health tips on post-operative care, which is the last one, intra care, which is during the middle one, and pre-operative care, which is the first preparation to make your surgery a successful one, so that you will go to your home successfully and witness it to people, so that they too will confide in us in every aspect, whether medically, surgically, every aspect of health. Till we meet again on the next side, or the right side of health issues. Keep on subscribing Greatstar channel, Greatstar show on YouTube. The beauty queen is there in every aspect.